Hey everyone, and welcome to today's Explainer. So glad you're here. We are tackling a topic today that is, well, it's absolutely crucial, but it's one of those things we rarely talk about out loud. We're diving into a patient guide on ejaculation problems and male infertility. We'll be using some fantastic insights directly from the experts at ART Fertility Clinics to guide us. We're going to take all that heavy medical jargon, break it down, and look at the real practical solutions that are out there. So, if you or someone you love is navigating this right now, take a deep breath. You are exactly where you need to be.
Right off the bat, let's look at this number, 5 to 40%. That is the chunk of sexually active men dealing with premature ejaculation alone. I'm bringing this up right at the very start because, honestly, there's just way too much unnecessary stigma and silence around male sexual health. Seriously, if you're experiencing any kind of ejaculation issue, you really need to hear this. You are absolutely not alone. It's super common, it's just a medical condition, and the best part, it's something that can actually be addressed.
So here's our roadmap for this explainer. First, we'll cover common ejaculation problems, then we'll break down the 4 main types. After that, we'll look at how it affects fertility, diagnosing these issues, and finally fixing ejaculation problems. It's just a step-by-step path from understanding to solving.
All right, let's jump straight into Section 1, Common Ejaculation Problems.
Now, it's important to understand that ejaculation issues are actually one of the most frequent sexual problems in men. This isn't some rare one-in-a-million anomaly, right? It's a completely routine medical reality that fertility clinics see literally every single day. Stripping away that embarrassment really is step 1, because the second we start treating this as a standard health issue, we completely open the door to effective care.
Moving right along to Section 2, the 4 main types. Let's simplify the terminology you might hear in a doctor's office. Now, what's really interesting about this slide is that this is the most common issue we see: premature ejaculation. It's exactly what it sounds like, really, ejaculating too early or rapidly during sex. This is the specific condition affecting that massive 5 to 40% of men we were just talking about.
Now, the exact single reason why premature ejaculation happens, well, it's still a bit of a puzzle for the medical community. But we do know it generally falls into 2 distinct buckets. On one side, we have psychological causes. We're talking relationship problems, deep-seated anxiety, or depression. And then on the other side, we have biological causes. This could be abnormal hormone levels, genetics and heredity, or even something like an infection in the prostate or urethra. So it's really a complex mix of the mind and the body.
Now, on the total opposite end of the spectrum, we've got delayed ejaculation. This is a condition where, you guessed it, ejaculation takes a significantly longer time to happen, and the triggers for this one can be all over the map. It might actually be a side effect of certain medications you're taking, or maybe an underlying chronic health condition. It could be the aftermath of a surgery, or, just like premature ejaculation, psychological factors can absolutely play a huge role here too.
Next up, we have retrograde ejaculation. I know, it sounds super technical, but the mechanics are actually pretty straightforward. Basically, during an orgasm, instead of the semen releasing outward through the penis like normal, it gets redirected and actually enters the bladder. Kind of wild, right? So why does this happen? Well, the clinic data points to conditions like diabetes, anatomical defects, certain medications, or sometimes it happens after a prostate or urethral surgery.
Finally, the 4th main type is anejaculation. This is the complete absence of ejaculation. Typically, this is linked to nervous system factors, so things like a spinal cord injury, multiple sclerosis, or Parkinson's disease. But it can also be triggered by specific medications or physical problems down in the bladder neck and urethra. All right, that brings us to Section 3, how it affects fertility. This is really the elephant in the room when we talk about reproductive goals.
Okay, let's dive into this. Can ejaculation problems cause infertility? For so many patients, this is their absolute biggest fear the second they start noticing symptoms.
And the straightforward answer here is yes, they are a significant cause of infertility, especially in young males. But let's actually look at the mechanics of why that is. First off, it really just comes down to basic biology. If ejaculation does not occur intravaginally, which happens with severe premature ejaculation, delayed, retrograde, or anejaculation, achieving a natural pregnancy becomes incredibly difficult. On top of that, specifically with premature ejaculation, medical findings show that the actual quality of the semen itself is often reduced, so it just creates another physical hurdle to getting pregnant.
But hey, here is the good news. We are moving to Section 4, diagnosing ejaculation issues. Walking into a fertility clinic can feel super daunting, but honestly, it's just a predictable checklist. Step 1 is a semen analysis, where doctors are specifically checking volume. Step 2 involves your standard physical exams and blood tests.
Remember those biological and hormonal factors we talked about earlier? That's what they're checking for here. And step 3 can involve diagnostic imaging of the prostate and seminal vesicles to spot any physical defects. It's a completely methodical, very safe process, and it's entirely focused on finding your specific answers. Now, I want to pause on that first step for just a second. Ejaculate volume is the primary parameter of a semen analysis, because these ejaculation problems directly impact semen quality and often result in a much lower ejaculate volume. This routine check is absolutely crucial. By measuring this volume, doctors can effectively hit the nail on the head, figure out the exact nature of the problem, and get right to managing it.
And that perfectly sets us up for Section 5, fixing ejaculation problems. This is where all that diagnosis pays off. Depending on what the doctors find, clinics have a massive toolkit of treatment strategies ready to go. We're talking specific medications to correct biological or hormonal imbalances. It might involve behavior therapy to tackle those psychological barriers like anxiety. Or it could even involve advanced reproductive therapies designed specifically to help couples achieve pregnancy even with these hurdles in the way. The bottom line? These issues are highly manageable.
So if there is one crucial thing you take away today, it's this. Identifying the ejaculation problem is the very first step to resolving infertility. I mean, you can't fix what you don't understand, right? By taking that brave step to just say, hey, something isn't working right, and getting a proper medical diagnosis, you are actively unlocking the path to your reproductive goals.
We have covered a lot of ground today, from the different types of ejaculation problems to the reassurance that they are incredibly common and, yes, very treatable. So I want to leave you with a final thought to mull over. Knowing that these issues are treatable, what step will you take today to reclaim your reproductive health? Whether that's finally having an open conversation with your partner or just booking a simple consultation at a clinic, the power to change your story is entirely in your hands. Thank you so much for hanging out with me for this explainer, and here's to your health and your future.